Hello and welcome. Today we're diving into a significant yet often overlooked area of urological health: bladder trauma. We'll explore the causes, effects, diagnosis, and management of injuries to this crucial organ. Whether you're a medical professional looking for a refresher or simply curious about the human body, this video will provide a comprehensive overview of bladder trauma. Let's start by understanding what can cause bladder trauma. The most common culprits are blunt force trauma, often from motor vehicle accidents, falls, or direct blows to the lower abdomen. Penetrating injuries, such as gunshot wounds or stab wounds, can also directly damage the bladder. In addition, iatrogenic injuries, which are injuries resulting from medical procedures, can occur during pelvic surgeries, cystoscopies, or other interventions involving the bladder or surrounding structures. The location of the bladder, especially when full, makes it vulnerable to these types of injuries. Now, let's discuss what happens when the bladder is injured. The pathophysiology of bladder trauma depends heavily on the mechanism of injury and the integrity of the bladder wall. In blunt trauma, the bladder can rupture due to a sudden increase in intravesical pressure, especially if it's distended. This can lead to extravasation, where urine leaks into the surrounding peritoneal cavity or extraperitoneal space. Penetrating injuries, on the other hand, cause direct laceration of the bladder wall, resulting in similar extravasation of urine and potential introduction of bacteria into the sterile peritoneal or extraperitoneal spaces. Prolonged urinary leakage leads to inflammation, peritonitis if intraperitoneal, and potentially sepsis, a life-threatening response to infection. While exact figures are difficult to pinpoint, bladder trauma is relatively uncommon but carries significant morbidity. It's more frequently associated with pelvic fractures, particularly in motor vehicle accidents. Men are more likely to experience bladder trauma than women, likely due to anatomical differences and higher rates of trauma exposure. The incidence of iatrogenic bladder injuries is dependent on the type and frequency of the medical procedures performed. It's important to remember that these injuries can affect individuals of all ages, though the mechanisms and associated injuries may vary. The signs and symptoms of bladder trauma can vary widely depending on the severity and location of the injury. Common indicators include gross hematuria, which is visible blood in the urine. Patients may also experience suprapubic pain or tenderness, difficulty or inability to urinate, and signs of peritonitis, such as abdominal rigidity, guarding, and rebound tenderness. If there is associated pelvic fracture, that will also cause pain, swelling, and instability. In cases of penetrating trauma, the entry and exit wounds may be evident. It's crucial to consider bladder trauma in any patient presenting with these symptoms, particularly following a traumatic event. Diagnosing bladder trauma requires a thorough evaluation. The initial assessment includes a detailed history and physical examination to identify the mechanism of injury and assess for associated injuries. Radiographic imaging is essential. A cystogram, which involves instilling contrast dye into the bladder and taking X-rays, is the gold standard for diagnosing bladder rupture. A CT cystogram offers better visualization of surrounding structures and is often preferred. Ultrasound can be useful for initial screening, particularly in unstable patients, but it is not as sensitive as cystography. In addition, laboratory tests such as urinalysis, complete blood count, and electrolyte levels help assess the extent of injury and identify any associated complications. Bladder trauma is broadly classified into two main types: contusions and ruptures. Bladder ruptures are further divided into intraperitoneal and extraperitoneal ruptures. Intraperitoneal ruptures involve the bladder wall tearing directly into the peritoneal cavity, leading to significant urine leakage within the abdomen. Extraperitoneal ruptures occur outside the peritoneal cavity, often associated with pelvic fractures, and are usually less severe. Furthermore, bladder ruptures can be described as simple or complex, depending on whether there are associated injuries to other organs or significant contamination. The treatment of bladder trauma depends on the type and severity of the injury. Bladder contusions can often be managed conservatively with catheter drainage to decompress the bladder and allow it to heal. Extraperitoneal bladder ruptures can also be managed conservatively, in some cases with catheter drainage, antibiotics, and close monitoring. Intraperitoneal bladder ruptures generally require surgical repair to prevent peritonitis and other complications. The surgical approach may involve open laparotomy or minimally invasive techniques, such as laparoscopy or robotic-assisted surgery. In cases of penetrating trauma, exploration and repair of any associated injuries are also necessary. Post-operative care includes continued catheter drainage, pain management, and monitoring for complications such as infection or stricture formation. Preventing bladder trauma primarily involves reducing the risk of traumatic injuries. This includes promoting safe driving practices, such as wearing seatbelts and avoiding distracted driving. Workplace safety measures and fall prevention strategies are also important. In the context of medical procedures, meticulous surgical technique and careful patient selection can help minimize the risk of iatrogenic bladder injuries. The prognosis for bladder trauma is generally good with prompt diagnosis and appropriate management. However, complications such as infection, urinary incontinence, and urethral strictures can occur. Long-term follow-up is necessary to monitor for these complications and ensure optimal bladder function. Recent research focuses on improving diagnostic techniques, refining surgical approaches, and exploring regenerative medicine strategies to enhance bladder healing. Further advancements aim to minimize complications and improve the overall quality of life for patients with bladder trauma. Thank you for joining us on this exploration of bladder trauma. We hope this video has provided valuable insights into this important area of urological health.